Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 update for the week of July 12th, 2020, looking at both the world and the United States. Looking back, had been about 100 deaths reported worldwide by the end of January 2020. These numbers have really exploded since then. It's important to remember that this is an epidemic, a pandemic that was unknown before 6 months ago, and it continues to grow worldwide. Now with well over 500,000 deaths and almost 13 million confirmed cases around the world. If you look at deaths per million to give you a sense of how heavily impacted countries are, these are the top 20 countries in the world. And there are a couple of things that are important to look at this. One is, even within the top 20, there's a huge difference, almost a five-fold difference, slightly more than five-fold difference between the 20th and the first country in terms of deaths per million. But the other thing that's important to look at is where these are. Dark blue now is North America, pink is South America, yellow is anywhere else, white is Europe. And you can see that at least in the last 6 months, the greatest impact reported anyway has been in Europe. But if you look at rate of growth, you can see that the consistent increase in growth has been largely in South America and North America. But one thing that's really important to point out, this doesn't mean that there aren't places in the world that are having worse impacts of this pandemic. They're just places that typically we can't get reporting data from, or their system is not sufficiently sophisticated to report. So this is really the tip of the iceberg. Just as the 500,000 deaths really underestimates the total global impact, so does this. But what you can see from this, and what it's important to keep in mind, is that while we have a global pandemic, it's made up by regional outbreaks, regional epidemics, if you will. It hit in Asia first, and then now it's been in Europe for many months, and now it's exploding into South America and North America as well. If we look at the US, again, we had one death reported by March. It has been growing ever since. This sort of inexorable growth, such that by July 12th, we now have over 3 million cases and 137,000 deaths. For anyone who questions the importance of this pandemic, in the first 6 months of the US, we would estimate that these would be the 10 leading causes of death. Right? COVID-19 would come in third, behind only heart disease and cancer. This is a real and serious pandemic that we're in the midst of. If you look at average daily cases, moving average, you can see that after the initial explosive growth, we were pretty much in control in terms of 7 days until the last couple of weeks when we've been increasing again. And if you look at cumulative deaths early on, the growth rate was very rapid. It started to drop, and then in the last few weeks, it has been creeping back up again. And so if you look at this chart of new deaths, you can see down there in the lower right, after slowly decreasing, it's been creeping back up again. And the same is true with hospitalizations. Again, it was dropping nicely and then has crept back up again. So this tells us that there is, in fact, an ongoing pandemic in the US, made up largely of regional outbreaks. Here are all 50 states. There's two things that are worth paying attention to here. One is the incredible difference that exists in different parts of our country. We have about 10, actually a little over 10 states with over 500 deaths per million, and then we have an equal number with under 100. And if you believe, as I do, that the lower incident places will eventually start seeing increases in numbers, as we've seen in South America and other places, you begin to realize that we're still quite vulnerable to this pandemic as it evolves. The second thing that's worth paying attention to is the regional variations. Pink is the Northeast, dark blue is the Midwest, yellow is the South, and white is the West. And you can see that historically in the States, it's been the Northeast, followed by the Midwest, followed by the South, followed by the West. But if you look at this map, the dark red are Just in the last week, increases in the number of cases. And again, you can see it is growing most rapidly in the South and Southwest. And then the same is true with deaths. So we're in the midst of an evolving pandemic. There's a lot that we don't know. One of the clear messages is we're not out of the woods yet. We're still seeing at least regional increases of pretty significant size. So it's still time to pay really close attention to this, do all the things that we know we need to do. Testing, contact tracing, wearing masks, social distance, hygiene. This is not the time to back away from what we know can make a difference. There's a lot more information on our website. If you go to the College of Public Health website and click this icon, you can get a lot of other information. But if you have any specific questions, please let me know. I'd be happy to try to find an answer for you. Thank you very much.